our wellbeing service that was developed over that time. Starting at the top middle box, this indicates the overall monitoring by a consultant psychologist, a role that we had to maintain, with a responsibility to triage all email contacts and also available for mental health escalation and the link to our adult mental health colleagues next door. Followed by our wellbeing coaches, who would offer on average 4 to 6 callback sessions for a range of topics such as anxiety, mood disturbance, work-related stress. And then our peer support workers, who are identified by wearing badges, but also announce themselves to their teams. And they were available on the ground for quick conversations about concerns, but also to signpost to others in the wellbeing structure or to other services in the hospital, such as for financial advice and occupational health. And our trauma risk management team acted as rapid first responders when any traumatic event happened, which could be patient-related, but also for team support. For example, following the death of a colleague, as mentioned by Dal, this sadly happened. And these people also provided train-the-trainer cascade training to enable psychologically informed conversations using the REACT mental health method. And this increased our workforce confidence in being able to speak up about their emotions at team huddles, etc. We also developed a range of educational resources. Again, from hearing the themes that were being raised via our email, we gave out weekly wellbeing messages via screensavers and posters. We created our weekly webinar called Wellbeing Wednesdays with topics such as stress management. And we also created a range of information notices, such as banners at every exit reminding people to think about their well-being, and foldable pieces of paper that called Z-cards that contained all our well-being information and helper resources that we developed. And they were given to all staff, but especially to all new starters. And the circle refers to our team-based support, which is an area that we're still developing. And this indicates some of the offers that we've made. So using our TRIM practitioners to help with team function diagnostics, through to promoting team-led self-care, such as the check-in huddles that you saw from our animation. And some teams have requested regular team coaching, support and opportunities to be able to consider what we call the everyday traumas they experience, but together as a shared group. And finally, targeted team intervention that we offer in the event of a serious concern or event, such as an unexpected death. And the training and ongoing supervision of non-psychologists was provided by an expert external team called Talent for Care. And this video explains their approach.
Narrative transformation. That's a model that we've developed over the last 10 or 15 years, which focuses on, rather than the circumstances, it focuses on how we relate to our circumstances and how the stories and narratives that circulate, either that we tell ourselves or that others are telling in the organization, how they shape our experience. So we work with people on transforming and empowering themselves to be in control of, masters of, authors of their own stories about the pandemic, so that they could empower themselves and thereby help to empower others.
And by telling people their own stories of the pandemic, they set themselves on a pathway to recovery. And by experiencing that in the programme, they learn how to encourage others to do the same when they're out there as a peer support worker, having conversations across the hierarchy, supported by social media, supported by practice partners on the programme, supported by us in the background. They feel heard, they're able to have their colleagues feel heard, and that's the beginning of the pathway to recovery and resilience.
We talked about innovation, and innovation is in what we do, as Mo and Sally explained, with a very specific approach that we developed over many years and perfected through the pandemic. But it's also about how we do it. Technology with a small t, like Zoom and WhatsApp and Microsoft Teams. But that's how we deliver our program, or this is how we engage with the workforce. And that is very, very critical, because we develop the ability to recreate engagement without being there, which means everyone can join in at any time without disrupting the work schedules. And through a pandemic, that's obviously particularly relevant. And we're using all this that we developed before the pandemic and perfected through the pandemic to think about how we can transform support and well-being for health and care teams well beyond the pandemic.
And the impact? One of my greatest personal memories of COVID was a shift in the public's attitude towards the NHS. And only time will tell if this is truly a gift. Medicine, science was seen as an ally. Our expertise was honoured, acknowledged and accepted, not something to be treated with scepticism or caution. Within healthcare organisations, priorities changed. The well-being of NHS staff became important. The NHS was cared for as much as we cared for our communities. Our NHS staff became heroes. Within GOSH, we saw evidence of the wellbeing service being used. As a comparison, in 2020, Care First, our external provider, received 72 calls for emotional health. The GOSH Wellbeing Hub engaged in more than 1,100 interactions with staff and responded to over 600 emails. Staff reached out for a multitude of reasons, including bereavement, work stress and burnout, redeployment, difficulty sleeping, low mood and anxiety, and difficulties with their personal life. And owing to the gravity of the conversation, 72 interactions resulted in escalation for treatment and expert care for serious mental health concerns. Staff members were asked to complete the staff survey in the autumn, 6 months after the wellbeing service had started. We saw a 17% increase in staff responding to the question, does your organisation take positive action on health and wellbeing? This is the largest positive change of all the questions asked. But as you can see, we still have a long way to go.
And we're so proud of what we set up, at pace, with no money, no real guidance on what was best, and depending on the goodwill of our colleagues. But we did it. And the number of reports I've heard from other healthcare services saying that they couldn't do much because they didn't have the time, I sort of find this unacceptable. We all have the same amount of time, 24 hours in a day. It just depends how you use it. And we talked about the importance of our messaging, the badges, but the colleagues who stepped up to the plate to become involved in wellbeing are also really proud of themselves. They were proud to belong. And this is a logo we developed, made into our badges, which people wear with pride. It's on our email signatures and on all of our banners, posters and notifications. And it's become clear that wellbeing is not just for COVID. Establishing an easily accessed expert wellbeing service has shown us all how important this is and why it should be offered as routine. All healthcare settings experience everyday trauma, and staff should have a place to go when this starts to impact. We've discovered that one size does not fit all. Some staffing groups don't easily accept what they perceive as touchy-feely self-analysis. They like their emotional suits of armour. But that doesn't mean that they're not impacted emotionally, and we need to create different methods and approaches. So any wellbeing service needs to audit, evaluate and adapt. A wellbeing service cannot be imposed or mandated on others, and so there needs to be constant thinking around what constitutes psychological safety in the workplace. And we learnt that wellbeing terminology is important. Wellbeing is a positive attribute, it's not a negative or a deficit. It's important that any wellbeing offering doesn't start from the premise that there is something wrong with you.
I thought I would end with some reflections on what we'd learned. Our success lay in a distributed, expert-led service. We recruited colleagues across the hospital as opposed to setting this important task to one team, the HR department. It became a staff challenge that staff were responding to. Every idea or experiment was welcome. And as leaders, Mandy and I became responsible for integrating and aligning all the elements to form a coordinated response. Context was so important. In the execution of any experimental solution, it was vital for us to consider our environment, our people, the uniqueness of GOSH. We listened to our colleagues and responded to their concerns, criticisms, requests. We focused on what mattered to them and made sure they joined us on this journey. After all, it was everyone's collective journey. In order to share their vulnerabilities, staff needed to feel psychologically safe, to be heard and included, and they did from their GOSH colleagues. Staff reported they know what it's like at Gosh. They know what it's like to work here. They understand us. We realised that listening skills are more crucial than expertise on mental health. Very early on, we resisted the pressure to train mental health first aiders, and our intuition was correct. We soon realised that to truly achieve staff well-being, we also needed to advocate for changes in organisational structures and processes, change the way we work, change the way the work is organised, and manage to minimise the emotional and mental load. This work complemented and enhanced the work and the achievements of our wellbeing group. In the first wave of COVID, for most organisations, business as usual was stopped. However, in the second wave, normal work resumed, and their staff were managing COVID on top of their normal loads. The impact was exhaustion, and the marathon is far from over. And as a service, we advocated upwards and sideways for our staff. At the start of COVID, we started creating a library of wellbeing resources on our hospital intranet. But as the list expanded, the degree of engagement dropped. The staff became overwhelmed by the overgrown list. It started to feel tokenistic. Therefore, we changed direction and started our weekly Wellbeing Wednesday webinar series. Any staff member could share a 20-minute wellbeing initiative. This became an engaging resource for staff created for our staff. This example, like many others, taught us the importance of adapting any of the digitalised offers as much as possible and build a number of nested communities, both to direct our work and help engage our diverse workforce. Mandy and I adapted an iterative approach. We spoke about this repeatedly, encouraging colleagues to experiment. We celebrated, we laughed, we embraced the successes and our failures. And Mandy and I became custodians of maintaining the energy, not providing the solutions. And finally, reinforcing Mandy's words, terminology was so important. Well-being was perceived better than resilience. The hook for engaging staff in this personal journey had to be mixed, not just the touchy-feely stuff. And the pandemic started the journey of destigmatising trauma, vulnerability, legitimising trauma for healthcare workers. And gradually, this was followed with staff servicing, acknowledging and speaking about their everyday traumas. Mandy and I feel very proud standing here today talking about our team's work, and we thank you for listening.
Thank you. This was so brilliant. Dal and Mandy, it's fantastic work, and I can see that you have absolutely been chatting during the presentation with some of our viewers. I think we are actually around 75 people on the call right now, and people from all over the world. Greetings from Hong Kong and so on. There were some questions in the chat, and I wondered if you might also elaborate a little on it. From Hannah Roberts, she says, I like the Gosh check-in with Teams. Is this still being used by Teams, or has it been stopped since the peak of the pandemic? And I think it's still being used, but can you elaborate a little on that?
Yeah, thank you, Inga. So yeah, the wellbeing script is everywhere now. So people start their meetings saying, how are you? How are you feeling? It's at handovers. Sometimes we use it in our exec meetings. So it's just everywhere. And it's just so lovely to start any meeting with, how are you? And just general concern. And I think it just changes the tone of the whole meeting. And so that's something we endorse right from the beginning. And it was just 5-second check-in, and it doesn't take long, but it makes all the difference for the people in the room.
So you think it will be there in 1 year or 5 years from now? You'll still have that structure?
I hope so. I mean, we're certainly speak about it at induction. We speak about it at handover. So if any new member is joining, they see what's been practiced. So hopefully, as the new replace the old members of staff, this will still continue. It's so easy to utilise that it just feels really intuitive. And I think the GOSH acronym itself just makes it very easy to remember.
Great tool to have, and that you are able to bring it to us all this way. Carolyn Ford asks, did you find any of the well-being coaches or peer support workers were being adversely affected by the difficulties that were discussed with them? So were there any support for the supporters, you could say?
Yeah, shall I take that, Del? Absolutely, and it's a really, really good question, and we did think of that. Within our psychology service generally, we offer internal ongoing support. Every psychologist has someone to talk to about the work they do, and we applied that same principle. So internally, through our psychology and psychotherapy structure, we offered any contact at any time from anybody who heard or was dealing with anything distressing. Plus, we had a consultant psychologist overseeing who was always available for check-in. They had internally to them set their groups, a WhatsApp check-in group, so they supported each other. And you heard from Talent for Care, our external the provider of training and ongoing supervision. They were also available for contact. But that is a really important feature of any internal wellbeing service. The providers of it must be supported. So a really good question. Thank you.
Thank you. There's also a question from Jo Kramer Johansen. She says, thank you for an excellent lecture. Can you elaborate further on the pandemic as a factor harness the will to change?
Absolutely. I mean, I think, to be honest, that there is absolutely no doubt in our mind that we had to do something. Our staff were feeling really anxious when COVID hit. And in truth, well-being really hadn't hit the agenda at GOSH prior to COVID. I mean, it was there in the background, but it was lightly there. Not people really weren't embracing it. But it really gave us permission to talk about it, permission to really acknowledge it, and permission to start building this multi-layered approach. So I think COVID in some ways was I guess COVID presented a huge opportunity for us, and for that we're really grateful.
But it's so fantastic. So how can the patients, this is a question for me, can the patients actually feel these changes and that you have worked this way? How does it show in the quality and safety of the patients?
I think for me, I don't know, Mandy, if I start and then perhaps you come in, I sense that my colleagues have almost dropped that shield they have, that shield that we're the doctor, we're the professionals, and they're just starting to show that bit more of their vulnerability, and with that comes more care, that desire to build relationships, to have conversations. So I think people's attitudes have changed, because people are looking after them, they feel more inclined to look after their patients. I just feel it's a reciprocal thing, isn't it? If I'm feeling looked after, then I'm more inclined to look after others. So that's certainly where I've noticed a difference. What about you, Mandy?
Yeah, I was just wanted to introduce a phrase that we coined, this everyday trauma. Everybody working in healthcare settings, in a way, experiences, maybe minimal, but the traumatic experiences, and just acknowledging that in itself, I think is helpful. That you deserve to feel looked after. You deserve to have an understanding of what it's like to experience that on a daily basis. It just makes you a better practitioner.
Fantastic. Yeah, I really agree with you. Tips Pereira is also there's a lot of applause for you, and it's so nice. Such a good session, and a reminder that the health and well-being of healthcare professionals is essential for patient safety. Was there a separate budget requirement, or was this completely a grassroots initiative?
I mean, thank you for the applause. I mean, we'll certainly take that back to the team because it was a team's effort and really shone through here. And it was all virtually done on discretionary effort. We had hardly any additional budget for this. So it really was bringing people together. The people became the resource in this initiative. So we're so grateful and so proud of our team.
Fantastic. There is a question more, but I would encourage everyone to put their questions in the Q&A because we are wrapping up in a short time. But please feel free to ask any questions. There is a question from a listener, a viewer, who says how to motivate everyone to stay positive and willing to use GOSH to their colleagues.
Yeah, shall I? Just because I think there has been something, as Dal mentioned, about a real change of attitude and embracing well-being, making it more normal and acceptable. And so it's almost become part of the habit of the everyday to just check in. So it's not necessarily a question of continuing to encourage or enthuse people to do it. It's become ingrained in routine practice. And that's just been one of the unexpected impacts of what we set up. So we although we do try and maintain some enthusiasm, we're always waving the banner, and everybody that's got involved, they love wearing their badges and their lanyards and being part of it. So there is an ongoing encouragement, but I'd say it's become more of a habitual change.
I think the other thing to add is that at times we don't need positivity. At times we just need to acknowledge that this is hard. And so one of our earliest messages is it's okay not to be okay. And we repeat that. And I think sometimes just acknowledging and certain that we are finding it difficult is also okay and it's important. So we repeatedly said it's okay not to be okay. And please talk to us, or please talk to your neighbours, or talk to your friends, but please don't try to bury it. So I think positivity is a balance, isn't it, in this situation? You kind of want to normalise things. You want to acknowledge how people are feeling, but equally you don't want them to get stuck. So what we were trying to do is trying to avoid them getting stuck in that negativity and trying to find a way for them to just try to take small baby steps away from that negative mindset, but also acknowledging that sometimes they will have a bad day.
Fantastic. Thank you so much, both of you. And the final comment I can see here on my screen is from Iris, who says, "Thank you so much for the interesting lecture. Great start of the morning." And I really think that you have set off this second day of the conference very well. So thank you so much, Mandy and Dal. It's amazing work, and thank you for inspiring us all with this very important topic today. Thank you so much to everyone who listened and watched, and thank you, Dal and Mandy, and please have a fantastic day, everyone.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.